is going to be about addressing some of the generalized concerns that some of the older students or older adults that are looking to go into nursing school might have. And that main concern is, can they do the job? How physically taxing is nursing? And I'm not going to lie to you, it is physically demanding, especially if you are going to start off in an acute care facility. You have to expect that it's going to require a lot out of you. And I don't think that it matters what floor in an acute care facility that you are working in, it's going to be demanding of you. So let's address some of your concerns about it and also some ways that you can help manage that if you are to become a nurse and you are an older adult. First of all, let's assess your health. Your overall health is important. You don't want to sign on to be a nurse if you have COPD or some other chronic disease that will wind you, or if you have a physically debilitating disease or ailment that will stop you from actually doing the job. You will be on your feet a lot because you will need to go from each patient's room, especially with that call light ringing or IVs going off or whatever emergency might be happening. You will need to get there, and you will need to get there quickly. So one of the things that you can do before you even apply for nursing school is consult your physician. Go ahead and get your checkups done, because you'll need to do that anyway. You'll need to get some immunizations and things of that nature before you even when you get accepted into nursing school to get cleared for certain things. So just schedule an appointment with your physician and get their recommendation. What do they think in your condition, your bill of health? What do they think of you actually taking on nursing school and becoming a nurse? Get their opinion. It doesn't mean you have to follow it, because only you know what you feel like on a day-to-day basis, but maybe base your decision with some of that groundwork of whatever their opinion is. You also want to prioritize your health. Make it a priority. Eat healthy. Maintain a healthy weight. Get regular exercise, as they always say. Do whatever it takes to help yourself out in that area. That's something that you can control. You can't control a patient load. You may not at times control the floor that you work on if you're a float nurse, and you just can't control what goes on in your shift. So just do what you can to control what you can. And that you can give yourself the best leg up in providing yourself with a healthy diet and also exercise, do that. Also, your mental should also be a priority as well. Now, on a shift, and to backtrack, I used to work on a med-surg floor, so it was busy. You may not get patients that are all in a nice, neat row on one side of the floor with rooms next to each other. There are times where you may need to run across the hall, you may need to run across the floor to get to your other patients. They're not going to be right next to each other. If you have patients right next to each other, it must be a glorious day. But it doesn't always happen that way, and I guess it just depends on the charge nurse and their preference. But some may be of a higher acuity, and I'm speaking for med-surg. Some patients might be of a slightly higher acuity and need more monitoring, so they might place them next to the nurse's station, and some may not. Typically, when a patient has a little bit of a higher acuity and they require more monitoring, they're going to be closer to the nurse's station, and everybody else will be situated in rooms that are farther away from the nurse's station because they are of less acuity, obviously. So take those things into consideration. Total care, you might need to provide total care to a patient, which means that you will have to, they're bedbound basically. You will have to turn them every 2 hours. Some patients are obese, especially here in the United States. Patients are getting heavier and heavier sometimes, and sometimes they require 4 to 6 people to help you turn that patient and provide total care. You might have to give an enema. Some patients don't walk. Some patients have cerebral palsy nature. So make sure that you are requesting help. They will impress upon you in nursing school and stress this point that you need to delegate. You cannot handle everything on your own. So keep in mind that you will always have help. Well, let me not say always, because depending on the staffing situation in the hospital that you're in, you may or may not have help. But, or, even in a skilled nursing facility or long-term care facility, you may or may not have help. I have heard horror stories of there being 20 patients to a nurse at a SNF or a skilled nursing facility or long-term care facility, and one CNA. So for the most part, you will have help. You can tag in your charge nurse, you can tag in CNAs and other nurses who have gotten all of their assignments and tasks done for their patients for the time being and can be able to help. But don't think that you're going to go it alone the majority of the time. But the best thing that you can do in that area is to learn effective time management techniques. So you're going to want to cluster your care. So if you know medications are due at a specific time, let's say you have no antibiotics to pass and you're on a night shift, most of the time, most of your medications will need to be passed at like 9 o'clock. Try to cluster your care, get everything that you need to be doing with that patient done in that time frame while you're in the room. Chart while you're in the room. Change that dressing while you're in the room. In addition to passing the meds, make sure that you're giving them the time that they need while you're in that room. And then you can go on to other tasks and other patients. That also helps to decrease the physical demand on you because you won't be running back to that patient's room. Hopefully, in theory, assuming that they don't press that call button or call you on the Vocera. But just give yourself the best chances that you can. Set your shift up in the best way that you can. And when you're in nursing school, that's your chance to kind of see the overview of what a nurse does and kind of figure out how you would set up your shift when you become a nurse. Typically, when I was a med-surg student, when I was in med-surg and became a nurse, I would want to, of course, get report on all my patients, take a look at my patients' charts, figure out what meds need to be passed as a priority, figure out what orders are in that I would need to do, and go from there. You can also prioritize what care whose room you're gonna go in first, and when you're gonna pull your meds. These are all considerations. Pull your meds all together for every patient. Of course, you don't want to pocket anything, but if you have a cart, like I had a cart, there were these carts on med-surg that had room numbers on them, and we would just put our medications or whatever supplies we needed for the orders that they had for that time frame in that drawer for that patient, so we were already prepared. So get your report, hit that med room, which would also be connected to the supply room, grab all your things all at one time, and go and fulfill your tasks for the 9 o'clock to 12 o'clock block. That's how I would prioritize, but it may be different for each floor that you're on. Speaking of running to each patient's room, in the ED, it's a little different as well. So rooms are more closer together. In the ICU as well, rooms are more closer together and patients are sedated. So you may have to do total care on those patients. And let me say, not all patients are sedated in the ICU, but most of the time they are sedated. And they are using critical medications and require critical monitoring. So you may have to monitor them more than you would in med-surg. So of course, the rooms are closer together and everything surrounds the nurse's station, so you can have, that view, eyes on them at all times, and be close to the monitors, and the medications that you have to pass are obviously more critical. So these are things that you should consider. I consider myself as someone that's somewhat fit, work out 3 times a week at least, and try to get that cardio in. I wasn't like winded on my shift or anything like that, but you definitely know that you earned your paycheck and then some at the end of a shift. You can be dead tired at the end of a shift. It requires a lot out of you, and also the mental stress that it has on you. It takes a lot out of you. Now, this video is not meant to scare you out of this. This video is not meant to scare you out of potentially going into nursing school, but to give you the real fact of what it entails when you do start in an acute care facility. It is taxing on the body. I have seen multiple injuries, so make sure that you are lifting patients. You shouldn't be lifting patients just like willy-nilly. Using the proper techniques, which you will learn in nursing school, and having that team with you, which you should have a team. The nurses station, the nurses you work with each night all understand that you can't get stuff done unless you have that team. And most likely you will have that team. So just know that you are able to handle this if you are of good health. If you are not, you might want to check with your doctor. I did have somebody that did have a something congenital that happened when she was a baby. It was clubfoot, and she was not walking properly during the program. However, she did have multiple surgeries, but you know, it was enough to help her walk. She was able to walk. She was still wanting to be a nurse. If she remained on her feet for like a long period of time, it did hurt her, but she was able to complete the program. And just keep in mind that you don't always have to work at the bedside. Obviously, my other videos stress working from home, so it's not going to be forever. If you can muster at least a year of working at bedside, then you're golden. You could always transition out, but initially, yes, it is stressful. It is taxing on the body, especially when you're not using proper body mechanics or taking care of yourself. So make self-care a priority and see your doctor for your annual checkups, and make sure that you have a clean bill of health, or as manageable as it can be. Hopefully this video provided you with some insight about how taxing the job is, because it can be taxing, and most of the days it is. Some days you'll get a light patient load, but those are few and far between depending on what's going on the floor that night. Hopefully you enjoyed this video. If you have any suggestions about what videos you want to see next, please do drop them below in the comments, and I'll be sure to make one. Okay? Have a good one, you guys. Bye.